everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching our earwax removal compilation video today. Now this patient, you can see we've got this very, very narrow ear canal, always a little bit more difficult to work with. You can see the entrance there is very, very collapsed. Now that's the standard size ulnar tube here. Always difficult because you tend to find with narrow ear canals the wax forms as this sort of wedge shape, which you can see here just at the entrance, which means the suction tube won't get a fantastic grip on that, unfortunately. So as you can see, I went in there to try and use the suction just to basically break that front end off, but it's so narrow it's easier for us to go in with a crocodile forceps. Patient was talking at this point as well, which doesn't make things much easier, but it does help to relax some patients if they can chat along with me while we're doing it, so I'm happy for them to do it. But you can see we managed to get a grip on this front section. The aim here, if it was a little bit harder, would be to try and pull the whole chunk forwards, but because it's not, it's to break that front end down a little bit. And then you can see I've got the Jobson horn in here, just trying to scoop the wax forwards, just trying to get it around that bend and get it towards the outer part of the ear canal. There we are. You can see we're going a little bit deeper now. Let's see if we can just get behind this neck section. Draw this down. This wax is this very soft, sort of clay type earwax. Isn't the easiest to get out with suction, but if you can break a good portion of it away first of all, which is what we've done there, you can see a nice big chunk of that's gone away. We can then tidy up with a bit of suction. Now I'm just going to take this next section. You can see where the ear canal just juts out a little bit. So I'm just trying to get rid of some of this this piece of wax that's sitting towards the front there. And the reason for that is I'm going to go in there with suction to try and tidy this up later on. I don't want any bits jutting off the sides ideally because they're just going to keep folding into the suction, but without getting a fantastic grip. So I want almost a kind of smoother surface, which sounds a bit counterintuitive, but you'll see why now. As we go in here, you can see there. Do you see that canal was just starting to collapse down just a little bit as we got the suction in there? Now that's something to be really, really careful of here. There we are. You can see it's just flexing a little bit on the ear canal. Now, it hadn't fully closed around the suction tube at that point. Now, if it had fully closed around the suction tube, then what can happen is it forms a fantastic suction seal. And then what you're going to do then is suck all the air out of the space that's beyond that seal, which can be really, really painful for the patient because it's going to put the eardrum under pressure. Now, if you'd seen a video we did a couple of days ago where we talked about somebody who's actually tried to remove their earwax using a standard home hoover, a vacuum cleaner, you'll see the state of the eardrum after that. So that's the last thing you want. So what I'm doing here is when I'm going in a little bit further, I'm just using the side of the endoscope here just to rest against the canal wall. So I'm holding one side of the canal wall, which has a little bit floppier there, but holding it across to one side. So it means when we're using the suction in there then, what we're doing is we're not collapsing down the ear canal. I've also switched at this point as well to a fine end. So you'll see a much, much smaller diameter tube, less chance of everything collapsing in around it. But it's something to be aware of if you're ever, if you're an audiologist watching this as well. It's really important you always keep an eye out for that collapsing around, especially if you're using an endoscope here. So we're just going in now, just got the crocodile forceps in here, so we're just holding on to this next section, just trying to draw this down. So we've gone from this very clay, thick, sticky type of earwax to this much harder type of wax now further in here, and it's really wedged deep in this ear canal. There we go, a lot of olive oil got in here just to ease it along its way. Where you do get it moving, it's less chance to stick against the canal wall again. So it's really coming away nicely there. Giving it a bit of a wiggle. Oh, thanks for all the people who commented asking. I said that we were going to, if you want to do, we'll do some more premieres and do some more wax removals with Taylor. Taylor is definitely going to do some wax removals. We're just rejigging the diary as we speak today to try and get a date. I shall put my teeth in and start that sentence again. I'm sorry, guys. A date and time where we can both get together in front of the screen as well for you. A good shout as well. Someone said, why do you do them blind like we did on the premiere? Yes, I'd love to do that because I really, really enjoyed that wax removal. So I think we might do them blind. I think we'll do, I won't show Taylor mine and I won't see Taylor's, and we'll see how we react to it. So this, you can see the eardrum there, not looking ideal, a little bit grey, a little bit dull, but it's nice and clear now, as you can see there. So looking a heck of a lot better on that side. A little bit more of an open ear canal on this one, not quite so narrow, but a little bit sort of twisted. And that also happens in people's ear canals. Everyone thinks that, ear canals are all roughly the same size, the same shape, they're dead straight. They're not. ear canals are like people. We're all different. We all look a little bit different, and we've got little quirks and bends and bumps and stuff in the ear canal. So what you'll get with these is sometimes you will get narrowings, which you saw in the first, and then sometimes you get twists, which is what we got in this one. And so everyone's ear canal's pretty unique, which is a nice thing. We don't all be the same, do we? So you can see now we're just getting a grip on this last little bit of wax, working it towards the outer part of the ear canal. It's getting a little bit stuck here. You can see I'm just adopting a little bit of a wiggle just to try and get this out of the ear canal. It doesn't really want to budge, so we're going to bring the Jobson horn in. There we go, in to save the day again, the Jobson horn there. Just getting behind that entrance, scooping forwards here. Out that comes. Let's get it all the way out. There we go. So a nice round block. You can see that skin there at the top. You can see that lighter colored material there. And then we've got some wax sitting behind it. So let's get rid of this layer of skin at the top here. Just giving it a little bit of a wiggle. There we go. And the reason I'm concentrating on getting the skin out first is to stop it from clarinetting. First of all, I want to get rid of the skin. And also what you'll see, as I'm trying to get to the wax blockage behind, the skin is folding down and just sort of blocking half the suction tube. So you're not getting a full grip on that wax there. So I'm going to aim a little bit lower. There we go, just wiggling again. Oh, we just broke a little piece off. You can see we're getting to this dry, crumbly type of wax now. So we're just giving this a bit more of a wiggle. There we go, it's on it. Oh, it's nearly. It's fighting. It wants to hang on in there. It doesn't want to come out. So I'm having to kind of rotate the wax. We're doing this this circular motion while sort of drawing this down. What I'm actually trying to do here is spin the wax. I'm trying to turn it so I get a better angle to get it out. Out comes that plug. Next pieces come forwards. And is this going to come away nicely? Or we're going to, no, bit of a wiggle for this one as well. Oh, it's got a bit stuck. It's on its way though. There we go. Out that one comes. You can see that kind of long husk. Another piece there. So quite a full old ear canal, this one. I think that piece is just going to break away. Oh, there we go. There we are. You can see we had to kind of push it and just to slide it underneath that top portion of the canal wall there. Long strip of dry skin just got sucked into the machine. If you blink, you miss it with that one. There we are. So this is what it looked like at the beginning. Lots of very dry, little bits of hair all stuck in there as well. Lovely clear ear canal there. So 5 centimeters, 1 7/8 of an inch. Guys, for our American audience. So you can see lots of different colors. There's lighter bits in there. That's bits with dry skin in it. We've got this really conker brown color. We've got this sort of darker color as well. All various stages of oxidation in the wax. Ooh, look at this one. So we've got this big clump of wax here at the entrance. This long, thin piece that goes behind it, going all the way down to another clump just in front of the eardrum. So let's pull this section first. There we go. That's the very front kind of block you could see as we looked in. And then we can get to this thinner side. So we're going to peel this off the canal first of all. There we go. And that's going to work all the way down. Sometimes we're lucky and the very tail of it will be attached to that last deeper section and that will draw down. Not so much in this case though. So you can see it peeled away from the side. Let's get this last little bit. Oh, now that looks pretty wedged in there. You can see that is perfectly formed to the shape of the ear canal. Not much in the way of wiggle room, but we're lucky we managed to get a good suction grip there at the entrance. If we draw this down the canal, there we go. If we needed to, then we could have got behind it with a different tool, maybe Jobson horn, Rosen inserter if we needed to there as well. But there we are. That's what it looked like to start with. So you can see this big clump, thin strip, big clump, and then this is what it looks like at the end. So a very, very different ear canal there. Let's take a look at this one. Oh, very humid ear canal here. So we're going to go in with the standard sized Zollner tube here. Oh, this is a difficult one to do. It's got this central depression and very thin layer of wax stuck to the outer part of the ear canal. The more sort of seasoned, I forget what was it waxaholics, I think you guys decided you want to be called. The more seasoned waxaholics among you will know that's due to somebody using Q-tips. You always get this central depression, everything gets squished to the sides. But not an easy one to do because we've got the twist, we've got a narrow, we've got it stuck to the canal walls, everything going on in this one. But we managed to get a good grip. There we go, out that comes. There we are, and there we go, we've got another little piece there. Can we get that one out as well? Yes, there it goes, out it pops. And we'll take it a look behind. Yep, there we go. Still going, lots and lots of little pieces on this one. The patient was really feeling quite blocked up. I think this particular patient was also experiencing a little bit of tinnitus as well, which had come on quite suddenly. And you can see why when the ear canal is that blocked up. It's not unusual to get these kind of issues. We'll see some scarring to the eardrum. Look out for the white cloudy patches on the eardrum, bit of tympanosclerosis. When we look back in, there you go. You can see that white cloudy patch going along this sort of U shape at the bottom. So this is what it looked like to start with, and this is what it looks like afterwards. Reasons you'll get that, it can be quite small. Let me do the 5 centimeters, 2 inch, 2 1/16 of an inch there, guys. The reason you get that white little bit at the bottom is for a number of different reasons. It can spontaneously happen as we get older, but when it's in that kind of long arc like that, you tend to find it's because somebody's had ear infections. Sometimes you get it with possible perforations as well. You get the scar tissue and this kind of calcification. It's almost like not calcification, but these sort of this sort of white cloudy patch that forms along the bottom of the eardrum there. Well, guys, I hope you enjoyed that video as much as I did voicing over. I always love voicing over the videos, guys. So as always, take care of yourselves, take care of your ears, and take care of one another. It is Mrs. B's birthday tomorrow, so I'm actually off tomorrow, but I'm going to pre-record your video for Saturday for you, so make sure that one goes out for you. So we shall see you again on Saturday. Have a great weekend, everyone, and I will be back again then on, after Saturday, obviously, on Tuesday. Take care, bye-bye.